diagnosis as such because they were still kind of trying to figure out why this 27-year-old was in here with heart failure. You know, so that this is kind of why she didn't even get a diagnosis. All right, so the treatment for PPCM is diuretics. Diuretics like Lasix, they really start on Lasix for women that's been holding that fluid, especially once it gets to the crackling in the lungs when you can hear it. You know, they do start that Lasix drug, clean them on out, all that fluid. The ACE inhibitors, which can be used postpartum as well. Before delivery, some women are able to be prescribed diuretics as well. Beta blockers should be considered and safe during pregnancy. Entresto, I would say, is one of the best medications that they are using right now with beta blockers because Entresto actually helps the heart muscle recover. So if she's at 15% heart function, I was at 15% heart function. I end up taking Entresto. Entresto, it made my heart increase to about 5 to 10% within about 6 months, and it just stopped. So I continued taking the medicine, and then another year, which was 2 years after diagnosis, I ended up being told that my heart fully recovered. And, you know, my cardiologist thinks that Entresto was the best drug that actually helped that. But the only thing with Entresto is if the mother doesn't have certain insurance and certain things, she may not be able to take the medication. That's the only downfall to that, which we're trying to. Oh, go ahead. Yes.
Is that okay? So it works in combination with the beta blocker?
Yes.
Okay.
Yes.
What's the mechanism?
And it's safe during the pregnancy as well. Maybe never.
How does it?
Like, how does it work?
It's
What
like
does it do?
as
And
in
it's like, how, what so like pharmacology, which you, I mean, yeah, like what makes it work?
Well, the diuretics is pulling there with like
So
extra.
it's a diuretic interest.
Yeah.
Okay.
No. Entresto is like the extra heart muscle, so it's like helping the heart muscle push straight.
Helps with
So the
contractility.
injection fraction. Yes, the injection fraction. So it helps kind of bring back that blood a little bit. Yes. I didn't understand. Okay, so the implantable devices, that's another one that they use for treatment because the implantable devices, like in my sister's case, she needed a transplant full blown out. Like the moment she got in there,